Maverick Physical Therapy, welcome to another episode of the Transformational Zones of Pitching. Episode, or rather, Transformational Zone 1C of pitching mechanics. So as we kind of wind this on down, and then after TZ1C transition to a TZ2, Transformational Zone 2 of pitching mechanics to conclude things, I'll be putting together some sequences of other videos and other episodes that will take a look at the transformation of, let's say, like the hips and the thoracic spine, the scapulothoracic joint, these big rocks that we talked about, in regards to the transformation from TZ1B to TZ1C. I feel like over time what we've been given in terms of a TZ1A and a TZ2, a beginning and end, is great, but we're missing two huge transformational zones that give us a great opportunity to assess in, to evaluate, and then also to treat, and then go after it with a performance enhancement based 3D Therax regimen. So in TZ1C right here, just a real quick touch up, and you can look back at TZ1A and TZ1B. In this episode, TZ1C, we'll take a look at the biomechanics of what has to happen in regards to being able to throw a ball consistently and efficiently well. In the second episode of this, we will take a look at what we can do to go ahead and mobilize the multiple joints that we're taking a look at, and what we can do activity-wise to help reinforce the mobility that we've gained with some functional strength and performance enhanced related type things. So in TZ1C, just a quick highlight. So if I'm going from the stretch of the slide step, we have our TZ1C. We've talked a lot about the importance of a top-down driver, this contralateral upper extremity driver, to help load the cannon, the hip, and the scapulothoracic and the thoracic spine. As we've transitioned from TZ1A to a TZ1B, right here we're now going to transition to a TZ1C. So we're getting ready to launch and propel our body and the ball towards home plate. What that will look like from an angle for you, it's here and it's here to a TZ1B, and then here to a TZ1C before I finish, throw the ball, and then have TZ2. In TZ1C, and again, in another few episodes, we're going to take a look at what happens between TZ1B and TZ1C, because there's a variety of things that will really transform and change throughout the hip and then throughout the thoracic spine, and get that runway, good old scapula there, scapulothoracic joint, ready for propelling and launching that load in the body as a direct result of what's happened from the bottom on up and from the top down with our driver. So let's look at a little TZ1C here. When we transition and sync on up into TZ1 and a TZ1C, I'm going to show you a couple different angles. So the upper extremity, the left upper extremity for a right-handed pitcher, is still loading the scapulothoracic joint on the right side as well as the left, to then further load this right hip to get it ready for takeoff and propulsion. So TZ1C here, if we get into TZ1C from TZ1B, and again we'll highlight the transformation that happens between the two, or from one to the other rather, what we have take place in terms of cervical spine, in terms of scap, in terms of hip, the hip now from the bottom on up, as we noted in TZ1B, we have extension of the hip and a lot of abduction of this right hip. We talked about how in TZ1B we get relative internal rotation. Even though the pelvis is, perhaps you could say, rotating left, it's still rotated right, and we're still getting a big top-down driver with that left upper extremity to help load up that hip, which is also giving us type 2 in sync loadability and motion throughout the thoracic spine, rotation right and side bend to the right. We have a ton of abduction frontal plane motion syncing up with extension and the internal rotation. Again, further episodes we're going to get nitty and gritty with that a little bit more and dig in a little bit more elaborately. We also talked about the scapula in terms of how it will retract, how it's going to posteriorly tilt, how it's going to inferior glide, how it's going to medially glide, and how it's going to perhaps kind of get ready to further kind of load on up from what our left upper extremity is doing. As we transition now to TZ1C, hip-wise, the pelvis now is going to further separate itself. It's going to propel itself out of internal rotation. It's going to sink on up and couple on up with external rotation extension and that good abduction that we've talked about. As it does that, the pelvis is now rotating left, and we get this out of sync like load that's now taking place in the thoracic spine from the bottom on up and from the top down, because the upper extremity here still loading that thoracic spine into right rotation, so we get this what we'll call this out of sync motion going in terms of pelvis. Our reference points are going to be the pelvic girdle and the shoulder girdle. We now have the pelvic girdle, which is rotating left, and we now have this continual kind of side bending right. So in the thoracic spine, you'd have this relative rotation right and the side bend, right, as we get this chain reaction like effect. We've talked about the chain reaction effect a lot in regards to, hey, we have this great multiple joint approximation like this screwdriver, this flathead, this Phillips screwdriver like fit, where we get this dynamic stabilization from compression, congruency, and all these co-contractions. So as things are starting to unload, we're still getting a great load proprioceptively speaking. That's where the stretch, compression, and tension comes in to take advantage of our muscle spindles, which are sensitive to length, change of length in terms of that loadability, that rubber band-like and slingshot-like effect. So as we transition here, we have this right rotation, this right side bend throughout the thoracic spine, pelvis-wise. So again, that's kind of a transitions from an in-sync to an out-of-sync type 2 motion right here. In terms of the scapula, we still have this posterior tilt. We have this inferior glide. So here's good old scapula right here. So we have this posterior tilt, we have this inferior glide, we get this retraction towards the midline, we get this nice kind of external rotation right here of the scapula as well. Helicopter just went down in the background. And so we've talked in other episodes with regards to some T-spine matrices that what the thoracic spine is doing, the scapula is doing, and what the scapula is doing, the thoracic spine is doing as well. And so as the arm is, you could state, yeah, it's upwardly rotated, but it's also really retracted and immediately kind of glided towards the midline of the body to really take advantage of that load and this contralateral loading between the hips. Take a look at some pictures, pull up some pictures from Google, whatever, and look at and try and find this TZ1B and TZ1C positioning. And take a look at from a posterior view, opposite hip, opposite shoulders, front and back, and take a look at the wrinkled patterns throughout these guys like a Verlander, like a Scherzer, like a Kershaw, that really get that great kind of loadability. So TZ1C, we're going to talk in some episodes on how what can potentially go wrong in a TZ1B or a TZ1C, and what we typically see as a compensation mechanism here. A lot of times today, with the elbows and the shoulders being chewed up the way that they have over the course of the last 15 or 20 years, there's a lot of things moving inefficiently and not sequentially functionally well. And there's things that are moving out of place and out of order. So a lot of times what you're going to see is things, let's say shoulder-wise or upper extremity-wise, instead of loading where they should be loading, they're going to be trying to unwind and unload early due to a lack of mobility or lack of functional strength somewhere else throughout the chain and the system. So in episode 2 here of TZ1C, let's dig a little bit deeper with some dowel work and some other functional progressions that I like to do to kind of go after guys in terms of assessing and treating. So the things that I'm looking for in TZ1C, we need release of that back hip to go into more extension as it transitions in the frontal plane from abduction and extension to abduction, extension, and external rotation with this type 2 kind of out of sync load. So we'll do a lot of work in regards to disassociating the pelvis from the trunk here, from the bottom up and from the top down. We'll go after some scapulothoracic stuff as well via some pendy swings, three-dimensionally kind of load things on up for you. TZ1C of the throwing and pitching mechanics, a very pivotal point and transition from where we began at TZ1A to TZ1B, C, and then eventually for us to throw the baseball and then slow everything down again. Have fun kind of digging into the mechanics of that a little bit. Episode 2 coming on up with succeeding or proceeding episodes that will take a look at the transition from TZ1B to C, hip, thoracic spine, and scapula, what's taking place a little bit more intricately. We'll dig a little bit deeper, but all very pivotal transformational zones that we as manual therapists need to assess in, evaluate in, and then also treat in, and then provide opportunities for our patients and our clients to reproduce those self-mobilized techniques with mobility-based activities, but then also some good functional strength activities so that they have great carryover from one thing to the next. Being able to throw is very pivotal and goes back to the roots of our Homo sapien-like ancestors with regards to hunting and gathering. Good, consistent, efficient motion and throwing mechanics here will take away a lot of the problems that we're taking a look at today and are really jumping into in terms of the elbow and the shoulder. Those guys are really getting banged up and really beat up, and they're really getting hung out there and really blamed and skinned and tarred and feathered, and it's really not their fault. They don't have anything to do with it. They're just really along for the ride, or they're just doing a little bit too much for the things that are going on around it. TZ1C coming on up, episode 2.